हेलो अस्सलाम वालेकुम माय लवली नर्सिस। सो हमारा जो आज का टॉपिक है वो है डीप वेन thrombosis. Deep vein thrombosis, we are also telling DVT in short form. So deep vein thrombosis, first we will talk about what is DVT. Deep vein thrombosis. Thrombus mean clot. So clot in the deep vein. That is deep vein thrombosis. Now we will talk about the pathophysiology. Pathophysiology. So pathophysiology, first we will talk about when this blood clot is happening. So it occurs when a blood clot or thrombus becomes lodged mean it become a clot and stuck in the deep vein, frequently where in the lower extremities, Now when this clot will lodged in the deep vein, so what will happen? Diminished or blocked blood flow. Why? What will happen? Causes inflammation and edema at the site of blockage. We are still discussing pathophysiology, huh? So our third point of pathophysiology, predisposed by, so we can explain by virtue triad. What is virtue triad? I will draw 3 circles there to explain you easily. So we are talking about thrombosis. So how we can explain this one, the thrombosis, by virtue triad? So this is just example. This is virtue triad. The number 1 is altered blood flow stasis. Altered blood flow stasis. When it is happening, when blood not moving all over the body, it will become clot. Stasis, no, the blood is become clot. So what will happen? Altered blood flow stasis, when blood not moving all over the body, it will become clot. Number 2, this one, the second one, endothelial damage. So what's the meaning of endothelial damage? With trauma or with surgery, if patient come with the trauma or after surgery or during surgery, causing extra clotting factors. So that is also the reason of thrombosis. Number 3, hypercoagulation. state, hypercoagulation state when is happening in the pregnancy. Especially pregnancy increase the risk for blood clotting. Pregnancy increase the risk of blood clotting. That is the third cause of this thrombosis formation. Now we will talk about the risk factors. What is the risk factors of DVT? So DVT risk factor is number 1, age more than 65. Number 2, immobility, especially those persons who's not moving too much. They don't have ability to move. Sometimes amputation, sometimes due to deep vein thrombosis also is difficult to move. So due to after surgery like knee replacement, hip replacement, many surgeries, the patient is not moving too much, no immobility too much. That is also the reason for DVT. Obesity, oral contraceptives, those females who's taking oral contraceptives is also become the reason for the coagulation factors. Number, the pregnancy. As I told you, pregnancy is the part of this triad virtue, so more risk. Surgery, this is also the part of triad virtue. Any fracture, malignancy, some type of carcinomas are also have this coagulation factors problem. So this is all the reasons for deep vein thrombosis. Now we will talk about the sign, symptom or clinical features. Sign, symptoms or clinical features. So once patient will come, what will happen? Keep in your mind cows. C-O-W-S. C mean calf pain. Calf pain and cramping. O, one-sided, is always unilateral. One calf will be, the size will be large and there is a pain or cramping. The one calf will be the normal one. W, warm and red. Warm and red because blood pooling. There is inflammation, and when you will touch, you will feel the calf, the affected leg is warm. S, shortness of breath, chest pain. When it will happen? If patient have PE. PE mean pulmonary embolism. This is the main complication of the deep vein thrombosis, because if thrombus will travel to the other parts of the body, for example in the lungs, it will cause pulmonary embolism. This is a medical emergency. We should have to inform immediately to the healthcare provider. Now, how we will diagnose patient have deep vein thrombosis? So number 1, we will check D dimers. Now, what is D dimers? D dimer is a protein actually. D dimer is a protein. Is release, the D dimer protein will release when there is a breakup of clots. So if the D dimer is high, it means the clots are breaking somewhere in the body. Okay, then the number 2, venous Doppler ultrasonography to check the size of the clot and the side of the clot, which side this clot is developing. Now, what's the treatment? Treatment, keep in your mind DV. D mean don't walk, bed rest. When, if you have clot, mean no any treatment still given, clot is still there, we will tell to patient don't walk, keep bed rest, because if he walk, the thrombus will travel to the other parts of the body like in the lungs, and it will cause the pulmonary embolism, so it will become a medical emergency. So we will tell to the patient don't walk, keep bed rest. And venous return, V mean venous return. Venous return mean elevate your leg. The treatment after clot. After clot mean the treatment already given for the clot. So now what we will do, keep in your mind the word chant, C-H-A-N-T, chant. C mean calf exercise. Calf exercise, sometimes patients cannot this immobilization, so we will guide the patient how to do the calf exercise. H, hydration, properly fluid. Why? So hydration will help to for the more properly circulation. A mean ambulation. Those patients who can walk easily, we will help the patient to ambulate. And mean no long sitting. No long sitting. For example, car, airplane, or the bed rest. Number T, the T, TED or SCDs, sequential compression devices, we have to use after clot resolve. One more nursing tip, keep in your mind. Some patients are using heparin and some warfarin. So for the heparin, because heparin is a anticoagulation, no? So it will help to dissolve the clot or broken the clot. So heparin will help to for the this thrombus dissolve. So in the heparin, during heparin infusion, what we will do, always check APTT level. In the exam they can ask you if patient is receiving heparin infusion, the continuous heparin injections at home, sometime in the hospital. So when patient is going home, we are also giving this heparin prescription is also there for the DVT patient. So during heparin, which test we are doing? So we are doing check the APTT. That is very important. What is APTT? APTT is APTT is activated partial thromboplastin. For the warfarin, we are checking. For the warfarin, we are checking PT and INR. What is PT? Prothrombin time, and the INR, international normalized ratio. This is very important in the exam. This is exam tip. For the heparin, we are checking APTT. For the warfarin, we are checking PT and INR during medication. Now we will talk about the nursing intervention. So for the nursing intervention, provide bed rest if prescribed, elevate the affected extremity above the level of the heart as prescribed. Okay, avoid using the knee gauge or a pillow under the knees. This is very important points. Provide bed rest, always elevation, elevate the affected extremity, elevate affected extremity. Okay, and then avoid using the pillow, avoid using pillow under the knee. Don't massage. If you massage the affected calf, what will happen? The thrombus will travel to the other parts of the body. Provide thigh high or knee high anti-embolism stockings, as I told you, the SCD and the stockings, as prescribed to reduce venous stasis and assist in the venous return of blood to the heart. Teach how to apply and remove stockings. Administer intermittent or continuous warm moist compresses as prescribed. Always keep in your mind as per the doctor orders. Palpate the site gently, monitoring for warmth and edema. Measure and record the circumference of the thighs and calves. Why? So we will check which thigh is the larger than the normal one. Monitor for shortness of breath and chest pain, which can indicate pulmonary embolism. Administer thrombolytic therapy if prescribed, which must be initiated within 5 days after the onset of symptoms. As I already told you, administer heparin therapy as prescribed to prevent enlargement of the existing clot and prevent the formation of new clots. So heparin is helping to prevent the enlargement of the existing clot that is already there, and also prevent the formation of the new clots. Monitor, I already told you, monitor APTT during heparin therapy. Administer warfarin as prescribed following heparin therapy when the symptoms of deep vein thrombophlebitis have resolved. So heparin we are always giving in the hospital during the inpatient, and warfarin is a tablet form we are giving to the patients for the home medication. Monitor this PT and international ratio during warfarin therapy. Monitor for the adverse effect associated with anticoagulation therapy. What the adverse side effects? Sometimes we are increasing the dose of the heparin or the warfarin, so we always check the bleeding. Always check the bleeding and observe for evidence of bleeding, because sometimes for example bleeding from the gums, nose, or bleeding in the urine. We also see the bruises. We also guide the patient, if he hit on the head, he should have to visit to the emergency department to see if there is any bleeding. Comprehensive neurovascular assessment like capillary refill we always check for the patient. Recognize the sign and symptoms of bleeding. Avoid prolonged sitting or standing, constrictive clothing, or crossing the legs when seated. Very important. Elevate the legs 10 to 20 minutes every few hours each day. Plan a progressive walking program. Inspect the legs for edema and measure the circumference of the legs. Avoid smoking. Avoid any medication unless prescribed by the primary healthcare provider or cardiologist. Instruct the patient concerning the importance of follow-up. The primary healthcare provider visits and laboratory studies, very important. And obtain and wear a medic alert bracelet. So if he will wear that bracelet, for example, if patient will go to any hospital, any facility, so they knows the patient have deep vein thrombosis, the history, and patient is taking the treatment for this one. So this is our all nursing intervention that is very, very important. I hope you understand the topic. If you like my lecture, please subscribe, share with others, and also give comments. If you did not understand anything, please leave a message in the comment. Thank you very much. Allah Hafiz.